Since 2013, Kenya has embarked on a transformative journey to ensure every birth and every death is counted, from the village to the capital. Through a web of dedicated officers and institutions, the Kenya Vital Statistics Report has become a cornerstone of planning, policy, and development. The journey starts at the grassroots. Assistant chiefs, acting as civil registration assistants, fill birth and death notification forms B1 and D2 for events in the community.
We have CHVs and village elders and also Nyumba Kumi. They give me some information that there is a lady who has given birth, and they give me the names. Sometimes they go collect those names or that data and bring to the office or give me a call, and I register them, or sometimes I go there to the homes of the deceased or either to the home where there is a birth.
Compared to some years back, most of the assistant chiefs in Kenya today are learned. You are supposed to know computer, that is technology. And so the process is so good by far. In every county, we have a registration office. So services have been brought nearer to the community.
In health facilities, health records information officers do the same for facility-based events.
My role as a HRIO is first to collect, that is to register any event of a death or a birth that occur in a facility. That is when we will come and we compile the notifications, then we put as a dispatch, then we take it to the registrar of birth and death.
We have a documentation and a review of our statistics every month. By so doing, we submit it from the nursing desk, and then when it comes here, they are able to review, and we come together to ensure that the births are recorded or registered.
Kwa majina ni hapa Nilelwa. Nimefurahi kupata notification birth ya mtoto. Sasa ni rahisi kupata birth certificate ya mtoto. Asante sana Kajiado Referral Hospital. Birth certificate yenye nitapata itasaidia mtoto wangu akianza shule. Siku hizi lazima kuwe na birth certificate. Itakuwa rahisi kupata kazi. Pia itamsaidia kupata kitambulisho akiwa mkubwa.
At the sub-county level, civil registration officers validate data, assign official entry numbers, and sign off the registers. They compile monthly statistics using standardized birth and death templates, which are sent securely to CRS headquarters at Has Plaza.
At county level, one, I oversee the 3 sub-counties. Then I'm also in charge of compilation of the monthly reports, and also I'm also in charge of the staff establishment that I have in the county.
We used to use tally sheets, whereby we would do it manually, and it would take a lot of time. But with digitization, we are able to compile our reports in time by just sending an email. The statistics section is able to receive your reports in time. Digitization has really improved service delivery, whereby even the retrieval of our documents has been very easy.
At CRS headquarters in Nairobi, data from 290 sub-counties is compiled and cleaned. The Statistics Division generates detailed tables breaking down births and deaths by age, sex, region, and even cause of death.
We are registering and keeping data from the lowest administrative unit in this country. So the data is so good for people who are planning, people who want to do any research, demographic, government officers and government institutions, and other organizations. They can be able to use this data for evidence-based decision-making.
How the data collected is used at the county level is used to inform the decision makers. For example, the births. The county is able to budget for maybe the maternity, the requirements, because if we have 700 deliveries, we need enough stock to cater for the deliveries. When we report the causes of deaths, the county is able to look at where the problem is and come up with solutions.
We came from a system where there was almost nothing to a very digitalized system today. We are providing technical support. We are providing cooperation with other, facilitating the cooperation with other nations to make sure that the Kenyan government has access to the latest technology, the latest methods of collecting data and registering data. We have over the years been supporting financially to build up that department.
Once the data is refined, the Kenya National Bureau of Statistics steps in. Together with CRS, they shape the data into the official Kenya Vital Statistics Report through collaborative seminars, technical editing, and statistical validation.
Registration at birth and getting a birth certificate for a child is very critical for the country in terms of strengthening the National Population Register, having sound population policies, and also provision of services to the citizens.
With UNFPA's support, the final KVSR is printed and published. Alongside it, fact sheets, county profiles, and policy briefs make the data actionable for counties and ministries.
Civil registration and vital statistics, a good system to manage and collect all of that data is probably the most powerful and smartest investment a government can do. It will ensure that all its citizens have a legal identity. That will ensure the foundation for these individuals, the citizens, to exercise their human rights. The other thing, the government, of course, has an amazing data set, and that will allow them to do proper planning, budgeting, resource allocation, and do smart investments where it's needed.
The collaboration between civil registration and KNBS in the production of KVSR is that KNBS mainly provides the technical support. So as we are doing the preparation, the guidance on technical issues are mostly provided by KNBS. UNFPA at the same time does provide to us financial support and also technical support. We've also have had other partners, for example, Vital Strategies that have been supporting us in other various activities.
From government ministries to development partners, the KVSR has become essential. It informs policy, funding, and service delivery and supports Kenya's social-economic goals.
A government with a reliable vital statistics system can be in a position actually to make a determination of the population of the country or any area at any given time. And that one actually normally informs the kind of decisions and interventions that that particular country can do for its citizens. So the Vital Statistics Report find actually its relevance in the whole ecosystem in terms of the fact that it gives reliable information for purpose of intervention in terms of health facilities, in terms of food, talk of poverty reduction and all these other things. There is no way you can plan for your people if you don't know the figures, you don't know exactly what affects them.
From humble beginnings in 2013 to a national benchmark by 2024, the Kenya Vital Statistics Report reflects a country determined to count every life and plan for every future.
Digitalization of CRS has made work very efficient.
Over the years, data collection has been reliable.
The journey as a health records and information manager has been fantastic.
I can say the process has been beautiful, good, and even the community has embraced it.